Do you worry about vocal nodules? How about polyps, strains, bumps, bruises, hemorrhage? Buckle up, because in this podcast I'm going to be covering every singer's worst nightmare: permanent damage. Okay, that was a little over the top, but I do find this subject way overblown. And it's not that vocal pathologies aren't a problem, a real problem for singers, but we need to have a serious talk about what is permanent and what is not. And you'll find that I'm going to talk about these things in a little lighthearted manner, and I do take them seriously, but we've got to separate the facts from the phobias. So let's get started. You know, I don't know of any other subject that fills up my email inbox more than, help, I think I permanently damaged my voice. Yet, not one of these emails is written by someone with a permanent pathology or even a real impairment to his or her voice. Now, I'm not suggesting that vocal folds can't be irreversibly harmed. They can. I'm just making an observation that a singer who fears damage is the least likely candidate to cause anything that won't heal. And then, ironically, it's the singers that feel invincible that should be more respectful of the physical limits of their vocal folds. I get a fair share of people come into my studio with voices that sound like this, and when I ask them how'd they get like that, it's always, I don't know, I was just singing one day and I noticed it was a little rough. And when I play 20 questions with them, it's not just one day, it's not just one song, which is usually the observation. It's usually a history, a low degrading tendency, let's call it. And they didn't respond until it became a real issue, and then they call me up, which I don't mind, but I find it very ironic that those that feel invincible need this advice the most, and that most of us are scared of permanent damage and don't have a shot at it in our future. Now, I understand why some people are paranoid. Losing the ability to speak or sing would be devastating. But I also want to be clear about this and honest, that playing on that fear is that all too often term, permanent damage. And I have two problems with this term. The first is that it's all too often not true. And the second is that it creates a far greater issue for singers, which is that fear. And I'll tell you, voice teachers, voice coaches like me are the worst offenders. We casually throw around that term all the time. Back when I was in college, my first voice professor used that a lot, that term. I was a rock singer and he hated rock, and this was back in the 1970s, and he constantly would tell me, young man, if you're going to continue to sing like that, to yell as you're singing, you're not going to have a voice by the time you're 30. Now, meanwhile, he would say this while stamping out a cigarette on his piano top. Back then, those professors, a lot of them smoked. All the vocal coaches smoked back then. Fairly ironic. And it's kind of like my mother telling me that I would permanently damage my eyes if I watched too much TV. And so those dire warnings tend to hide a bias. My mother just wanted me to read more, and my college professor wanted me to belt less. So the problem with using a fear as a teaching tactic, is that it plants insecurity in the minds of singers. And it also creates a kind of a passive-aggressive behavior pattern where singers become reluctant to fully challenge their voices in practice, but then respond to their lack of power by overcompensating in performances. Talk with a lot of singers, and they often tell me they don't want to warm up too much so they don't tire out themselves, and they'll also warm up quite softly cute little tiny, very friendly sounds. But then when they get up on stage, yeah, they hit it hard. And that's a rather big shock to the system. There's a gap there between what they do off stage and on stage. And their bodies know it's coming. Their brain knows what it's doing. And so the body braces for that onslaught that's coming. And that would be much better served if it were a gradual introduction to that kind of a load. So your goal when practicing should be to create an environment that's consistent with performance. And if you're saving your voice for performance, then the message that you're sending to your subconscious is basically that singing is bad. It's harmful. And often we singers have a clock in our heads, and we believe that the moment we start singing, our welfare clock is ticking away. And all that really suggests is that success would be a frightening thing. Because if you had to sing all the time for many hours, well, that must mean that you're eating away, chipping away at your welfare. And I think that's a horrible view to have of something you're passionate about. So I don't think that singers should be worried about their welfare while they're singing. I think that should be built into their skill set, into their technique. I think that should already be handled. Yet we think in words. So clear thinking requires very specific language, and you don't need a medical degree to become more knowledgeable about what's going on in your throat. It's just these are simple issues here, and swelling and irritation and strained muscles and bruises and calluses and blisters and infections, all that lovely stuff, they can occur anywhere in or outside your body. Yet when it comes to the voice, we tend to lump all these conditions into one major category called damage, and not one of them is permanent. So even though each of these situations can make your voice hoarse, they don't all have the same remedy. So let's sift through this here and have a frank talk about what's what. By far, the most common ailment is swelling. Good old-fashioned inflammation, also referred to as edema by doctors, and itis. Incidentally, everything with the itis following it, laryngitis, arthritis, all that means, the itis means, is swelling. And so laryngitis is just swelling within your larynx. That's why it's hard for the folds to vibrate. And irritation like this is caused by friction, pushing too hard when singing. It could also be caused by digestive acid, reflux, or infection. That'll cause the folds to swell also. So always use this condition when your voice gets a little hoarse. That means you're swollen. Use this condition as an early warning sign. Make the necessary behavior changes regarding the first two causes, just the pushing or the reflux. Those are behavior issues. Those are behavior and lifestyle issues. And the infection, obviously, it's not permanent, but you're going to have to deal with it depending on where the infection is. If it's in your folds, that would be viral laryngitis. And if it's up in the throat, that's pharyngitis. The pharynx is that area of throat above your larynx that's common to food and air. And so it's just important to respect that any change in your voice is an early warning sign. And if you disregard the hoarseness from swelling and start overcompensating and singing harder, well, then you can bruise your folds. And the bruise is just what doctors call a pre-node or pre-nodule condition. And again, this diagnosis is just a warning that you should make the necessary adjustments. Balance out your technique, balance out your diet. But if those words coming from a doctor, and incidentally, all of this stuff should be, all of these sort of diagnoses should be made in conjunction with an ear, nose, and throat doctor, commonly called an ENT. They have the necessary expertise and the eyeballs. As everything I do with a singer is an educated guess. I have to listen to hear what's going on. So I always suggest that people visit a doctor and form a relationship with an ENT especially when you're healthy, so that you can form a base. You'll know where your folds were when they were at their best. And that way, if you only visit a doctor when you're sick or swollen, he or she won't know if that's how off that is from your norm, put it that way. And so their diagnosis might be more dire than it should be or less. And so use the diagnosis as a warning sign, always. Pre-nodule, you're swollen. Usually doctors will say your folds look angry, they're red, and they might have excess mucus on them, and that would be another sign that your body's trying to protect you from you. That these are very early warning signs. And if you don't heed them, then you shouldn't be surprised that the next level of injury is on its way. And that would be a full-on nodule. And this is nothing more than a callus. If you've all experienced calluses on your hands, if you just rub them together, you can feel them, rub your hands together, you'll feel them heat up. And at the high points, right where your fingers begin there, you're going to get some calluses if you do this routinely. If you use a rake a lot or play drums or guitar, you know you get calluses on your fingers. And that extra layer of skin, which is good for guitar players, is detrimental to the folds because it ruins or disturbs the vibratory pattern. Your vocal folds are very soft, pliable tissue, layers of that. And what that callus does is form a hard spot right in the middle where they come in contact. And that's it's interrupting the vibration, I'll say. So it causes, it's like the fly in the ointment. It causes a disruption to the vibration, which then your knee-jerk reaction is going to add a little bit more force or compression and further irritate or inflame the situation. A close cousin to a node is the polyp. And the polyp is more of a blister. It's softer, and it's usually some fluid filling it. And the problem with a polyp versus a node is a hard callus. The polyp can sometimes be mushroom-like in shape. So therefore, the head of the polyp can wiggle around a little bit, and that would be giving you inconsistent problems. Sometimes your voice works, and the next note your voice will fail, whereas a node would be more of a consistent irritation or difficulty in singing. And so nodes and polyps usually require repeated abuse to form, and that's important. Polyps sometimes from a coughing jag or a hard trauma to the folds, really screaming, can sometimes allow a blister to become a polyp fairly quickly. But with nodes, it's always months of ignoring all the warning signs of hoarseness and reduced range and loss of control. When you have increased effort, when the same song is a little bit harder to sing and a little bit harder to sing, that's their shot across the bow, and you really have to respond to that. And then it's a very easy fix. And so typically there can be a strain, and if you're singing along and feel a pull or a sting, there's usually an accompanied voice hoarseness that comes with this, but that's more external of the larynx. It means you pulled a strap-like muscle that suspends the larynx in place. And as we're usually reaching for high notes and forcing chest register too high, these muscles that suspend the larynx in place can become strained, and you will feel that as a muscle pull, and then it will feel like your range is limited. That's only because your brain's not going to let you tense or stress those muscles anymore. And so in that same behavior category, in other words, if you always associate high notes with muscle tension, and now all of a sudden those muscles can't tense, well then your brain's going to say, we lost the high note. And so just to reverse a little bit, polyps and nodes, we can't feel anything on the vocal fold. The folds don't have a tactile sense of touch. There's a pressure sensor in the folds. That's represented in the brain, but there's no sense of touch. Otherwise, we'd feel them coming long before they were a problem. But typically, it just means when you pull a muscle that you should back off your pressure. Obviously, you've been driving too hard. And there's another immediate problem caused by driving too hard, and that is that you can burst a blood vessel, and that's called a hemorrhage, and that'll happen within the vocal fold. The vocal fold has blood vessels, and they're very fragile, just like those in your eye or those in your nasal cavity. And as you know from getting a nosebleed or having bloodshot eyes, it doesn't take a lot of force or friction to irritate those blood vessels. So if you inflame them because you're singing hard, and then if there's a violent cough or a scream, well, sometimes we can get what's called a bleed. And when this happens, the voice will shut down immediately because there's more fluid inside the fold. So one fold typically won't vibrate very well, and that will feel very strange to the singer. But again, the sensation, the physical sensation isn't painful. It's odd more than anything. And as bad as all this seems, it's not the end of the line for your future singing. All right, so let's go over some remedies. The first course of action for a hemorrhage is rest. And by rest, I mean vocal silence. If there's a bleed in there, the blood vessel will heal itself, but there can't be any further irritation to complicate that. Now, if the bleeding does not stop on its own, then a laser is what's necessary, and that is a surgical procedure. An otolaryngologist will use a amber laser because that has the least amount of heat and the least amount of collateral damage. Scary thought when operating on a vocal fold. At Harvard Medical School Extension, I took a course in laser surgery, and they had us working on eggs because the membrane there is very much like the surface of the vocal fold, and there's some little veins inside of an egg, and we were trying to cauterize them with a laser. And I must admit, I really just made scrambled eggs. So you don't want me doing your surgery, that's for sure. And I'm not a doctor. I just took the course so I could be more familiar with what I'm telling people. And the only remedy really for a pulled muscle, for one of those stingers, is time. And those pulled muscles, they take a long time to heal. It's a very nagging injury. You can still sing with a pulled muscle. You just have to be very aware of your behavior and not re-irritating it. And the same is really true for early stage node or polyp. You can still sing, but you have to be ultra careful. And often people with aggravating or imbalanced techniques aren't very good at being careful. A song will sort of lure them into their old behavior. So doctors will always just recommend rest for every one of these things, and that's not bad advice. But for me, it goes back to instilling fear in singers. If they get into a yin-yang of abusing their voice and resting and abusing their voice and resting, well, that's a terrible pattern. It's a terrible pattern physically, but I also think it's a terrible mindset to have about singing. And so more than anything, vocal therapy, voice lessons, if you want to think of it that way, is usually after rest, or if there's something important coming up. You have to have a change of behavior. That's what really brought on the polyp or the node or pulled your muscle. And while we rest, there is no behavior changing. There's nothing challenging that behavior. And so in the watchful eye, or ear, I should say, of a qualified vocal coach or vocal therapist, you have to modify your behavior, and that would be the real solution to a node, a polyp, or a pulled muscle. And if caught early enough, the node or the polyp will dissipate. The node will melt away, and the polyp will sort of reabsorb. But it has to be caught soon enough. And of course, if lessons or therapy is not successful, surgery is the next course of action, which obviously you want to take very seriously. And then after surgery, more vocal therapy is going to be needed because, again, the surgeon won't remove the behavior that caused the pathology in the first place. And I think that's so important to remember. So if at all possible, addressing any issue you have with vocal therapy will do two things, of course. It'll solve the issue, but it will also put you in the driver's seat in terms of your own vocal destiny, the condition of your voice. It's very important that you feel in charge with your condition. Be accountable for your voice. Now, there are, of course, situations where your vocal folds can be permanently altered. Nerve damage, scarring is a big one. And the big one about scarring is that scars are permanent and they alter the surface of the folds. You can also get an indentation if a node or a polyp isn't addressed soon enough. It'll cause a sulcus, which is a dent on the neighboring vocal fold surface. And, of course, cancers can cause some permanent alteration to your vocal folds. So abusive singing is not always to blame here, but it's often the case. And like I said, you want to be in control of the things you can. So there's enough inherent risks when we sing without fearing what is not within your control. Because the extra tension from your paranoia, your reluctance to be loose about singing something is what's sort of the source of the friction, and friction creates heat, and heat creates swelling. So it goes right back to the beginning of this podcast where swelling and inflammation is usually where everything begins. So respect hoarseness as a warning, and it's a fight back to paranoia with knowledge. Familiarize yourself. You can Google all of these conditions if you haven't already. There's a lot of information about this stuff, but more than anything, I want you to have the feeling like you are in charge of this. Don't let paranoia hijack your ability to sing. Your ability to captivate people night after night with your singing is directly connected to your ability to strike a balance between your physical condition and your desire to express. Don't let one cost you the other. I'm Mark Baxter for VoiceCounsel.com.